this is Dr. Mathew Stockstad. I'm going to be demonstrating 4 exercises that I give a majority of my lower back patients who are having lower back pain and many times sciatica that's associated with this. The first exercise that we're going to have Marissa do, who's my daughter, is to go ahead and bend her legs on up. In this position, for many people, this is just a comfortable position to lay on itself because it relaxes the curve of the back and flattens it out. Now the exercise that she's actually going to do with this is she's going to tighten up her belly muscles and she's going to also squeeze her butt. And you'll notice that what that did is it caused a slight pelvic tilt. What this does is it relaxes the disc itself that has been sitting in the pinch position like this. When she tightened up her belly, pulled it here, squeezed her butt together, it pulled it open more to the back, giving room for that disc and traction it out some. So this will be done several times over and over. Just relaxing the spine, tighten up the belly, squeezing the butt. And some people will hold that for 4 seconds, some people 8 seconds, and then relax it and then repeat it. Now this can be done anywhere from 6 to 12 times, again, depending on the patient's pain level and the type of treatment that we're trying to do. Now the next exercise she's going to do is this exact same exercise over again, and this time she's going to lift her buttocks off the floor. Now what this is going to do is it's going to strengthen the gluteal muscles or the buttocks muscles themselves. It's the supporting muscles here along the ribs, the hamstrings also, and it just helps to work on that core stabilization of the spine. Now here her arms are right down by her sides. And just go ahead and relax down. And this will be done several times. One part I did leave, and that is leave off, is if she does the first exercise, for many patients it helps to bring both arms over before she initiates that pelvic tilt. Now the third exercise that I want her to demonstrate is to go ahead and pull this knee into her chest. And when she does that, notice she's pulling on the top of the leg here. She's not pulling down here because we do not want to put undue force on the knee itself. In this position, as she pulls it forward, she also wants to try to lengthen the bottom leg and bring it flat against the table. And then she can repeat this to the opposite side. Again, she's bringing this leg in, supporting it from the top of the knee, and then trying to lengthen and flatten the flat leg to the ground. Then the next and the last final portion of this is to try to bring both knees into the chest. And again, this should only be done to comfort. There should never be any pain. If there's pain, then you want to relax this exercise. Pain does not get you any brownie points in this. The next thing you want to do, though, is to bring your head towards the knees. And what this is going to do is going to traction that whole entire spine out there, and it'll even give us some abdominal strengthening exercises as well. So you can just go ahead and relax down. And that's all there is. And how many you do and how long that you'll do them will be dependent upon what you're presenting with in my office. And again, remember that good health happens by choice, not by chance. And thank you very much, Marissa. And until next time, we'll see you then.